The outpatient treatment process for sex addiction is where you go to see a local counselor. You go in once a week or twice a week or once every month, however they set it up. Now, in that process, they'll probably encourage you to go to 12-step support groups, hopefully. They'll probably give you materials to read. You want to find out, though, a couple things. Number one, are they really certified in treating sexual addiction? You want to see if there's letters at their name. My favorite letters are SRT, Sexual Recovery Therapist. That means they went through the certification process through the American Association for Sex Addiction Therapy. There are other certifications, but make sure there's some kind of training that they've gone to. I personally Googled sex addiction in several different cities and found that on average, 90% of people who say we treat sex addiction have no training to support that. So your life could be very much influenced by this person. So make sure that you know that they know what they're doing. Another thing you want to know is what modality they use, as far as, are they open to working with the spouse, working with the marriage? Some will only work with the addict. You need to know that up front, instead of getting into a relationship with a therapist and finding out later that they won't see your spouse or won't deal with your marriage. And then you have maybe some conflicts going on there. So as long as you know what you're getting up front, I think that can be fine. And if you can't find someone in your area, there are people who do telephone counseling for sex addiction. You can call my office to find out about that. But this is something you can do locally, generally speaking, and they'll encourage you to go to support groups. They'll encourage you to get in materials. And depending on what type of sex addict you are, this can be adequate. It might be a slower pace than the intensive, less aggressive, but it can definitely be effective.